Okay, so let's start talking about mental Venous anomaly, and I'll go to Wikipedia to use this. So, the Venous anomaly, as the name suggests, is a Venous anomaly because the veins are not quite right. It's like a variant, anatomical variant. It's not very easy to see on CT without contrast, and remember that it's a Venous pathology, as the name suggests, so it's much easier to see on imaging that will let you see those veins. And what we are talking about is what you can see here quite on T1 with gadolinium. And maybe in order to start this, I want you to look on what is called a palm tree. And why to look on this? Because you will see that palm tree, the developmental venous anomaly, is like many veins that drain together into one big large normal vein, and therefore they are getting this image as they are like a palm tree, many veins condensing into one big vein. And maybe I will be able, it's also called a caput medusa. Maybe we'll get a caput medusa sign, and I think here there is a very good image that will let you see. So you can see that here, this is the vein. You can see that many veins are just coming together in a unnormal, not normal way. You can see the other side and draining like a palm tree into the main vein. You can see how we can just put here a palm tree or inverted umbrella to show you the many veins that condense together into one big vein. And this is called developmental venous anomaly. And it's quite benign, I must say, most of the time, tremendously most of the time. The patients are asymptomatic and this is an incidental finding. Sometimes it can come with other uh, malformations like cavernous cerebral venous malformation like cavernoma, cavernous hemangiomas, and then it is called mixed vascular malformation. Now, it's very important to remember that DVA1 are quite, compared to variants, they may be seen on imaging. They are from veins, probably something in biological that the veins didn't develop as quite, but they are usually benign. They usually don't relate to any hemorrhage, seizures, anything else. And if they are, it's usually because they are part of a mixed vascular malformation and the other pathology usually cause this. They are also very important to notice because we really don't want to interrupt this developmental venous anomaly. If the surgeon doing something and, for example, blocking this DVA, this developmental venous anomaly, it will cause a venous infarct to the area that should be drained by this developmental venous anomaly. So it's important more of because it's a variant, because we need to know not to do anything to this DVA, not to bind it, not to embolize it, not anything, because usually it's asymptomatic. Very rarely it may cause anything, but it's usually asymptomatic and should not be touched. It's not defined as do not touch lesion, but usually it should not be touched, more to be careful not to touch it than to touch it. But remember that it may be part of a mixed vascular malformation, so you can look for something else like cavernomas, even though the name cavernoma is not really good. Okay, so this is DVA, developmental venous anomaly, and this is the caput medusa sign. You can also see very, very beautifully on a SWI. You can see the palm tree sign and how it just converge into one big vein. Now, SWI, as you can see, you know, this is a GRE type imaging. It's very, very high sensitive for venous vessels. Therefore, it's a very good imaging modality to find those developmental venous anomaly. It may be that it may cause maybe some blooming artifacts because SWI is very, very sensitive. You can see on, for example, T1 with gadolinium, T1 with gadolinium, yeah, with contrast, much less clear to see this developmental venous anomaly. Even in T2, much less clear. But in SWI, which is much more sensitive for venous blood, you can see it much clearer. So SWI are very good sequences to see those developmental venous anomaly, as you can see, compared to T1 with gadolinium and T2 sequences. So SWI is much better. You can much really very appreciate the Kaput Medusa and the palm tree sign. Again, this is quite a benign lesion, almost do not touch lesion, but not defined as this. And you can see the treatment is isolated, no treatment is usually required. If mixed, you maybe need to treat the mixed something, usually carcinomas. If the carcinoma do some bleeding or something. But remember, if you touch it in surgery, you may cause venous infarction, so be careful not to touch it if you can. And of course, there is a differential diagnosis, but that's the main things. Now, let's read the practical points, and by that we will end this. Even though the imaging is quite beautiful, you can see here in a sagittal view this DVA. Think of an associated carcinoma when developmental venous anomaly is found in the context of intraparenchymal hemorrhage investigation, as isolated DVAs rarely bleed. Developmental venous anomalies can be subtle on MRI sequences, as we saw. T1 and SW, T1 in contrast, as especially I would say SWI, susceptibility weighted imaging, are more sensitive, as we saw. Even though here you can see here on it looks like T1 with gadolinium, you can see quite good. As I said, T1 with gadolinium help you see this. Yes, it's T1 gadolinium compared to T1, T2, which is less. They're also not that good, like T2, you know. Okay, so this is it about, as you can see, the clinical presentation that is usually incidental finding, patient with an intracranial hemorrhage and association, and also been described in scanning stroke and epilepsy. It's quite rare. I want to show you the area that says to the surgeon. However, essentially, a sclerotic and collection of veins can lead to venous infarction of meningioma. It drains. Here it is. Informing the surgeon of the presence of DVA is, however, essential, as cautery of the collecting vein can lead to venous infarction. Okay, you can see that it's extremely rare cases the DVA can become symptomatic by various vascular complication. Data suggested identification of the underlying pathomechanism by MR and DSA for proper management. The importance of the preserved integrity of DVA itself still hold true, so we need to stay to keep the DVA without interrupting it usually. Okay, so this is what I wanted to tell you about DVAs. Thank you very much. If there are any mistakes or correction, please tell me. This was an overview about developmental venous anomaly DVA, one of the most common, if not the most common, uh, very common incident for fighting on the brain. Thank you very much, and that's it for now. And we can end this, I think.